Hello everyone, how are you? This is Dr. Kim. Today I'm really excited to show you a case where the patient demonstrated significant improvement in the patient's maxillary sinuses over a year period. So what you're seeing now on the screen is a scan that was taken approximately a year ago, and the crosshair is pointing to a left maxillary sinus that is smaller than the right side. So we're looking at a hypoplastic left maxillary sinus that is completely opacified. So let me show you here the overall size of the maxillary sinus. Here's the right side and here's the left side. Obviously much smaller, right? That again can be confirmed on this coronal view as well. Not only that, it's fully opacified. Whereas if we go over to the left side, or excuse me, the right side, we have looks like possibly two dome-shaped opacity with the tiny little one at the anterior aspect of the sinus. So that was taken about a year ago. And now I want you to see how much progress it has occurred since the last time. So this was taken approximately, again, a year after the previous scan. And now you see that how much clearer the left maxillary sinus is. So let's scroll up and down. And besides the posterior aspect, right here, the majority of the left maxillary sinus is now clear. So that's a remarkable improvement. What I do know is that this patient was referred to an ENT for some type of clearance prior to implant placement. And I know that the patient has been cleared, but I'm not exactly sure what kind of therapy was rendered. I looked through the patient's medical chart, but it was not clearly indicated. So whether they did something or didn't do anything, but what we know for sure is that left maxillary sinus is much more clear and well aerated. Additionally, I do see that unsnit process is missing over on the left side. Now, how about the right side? Again, we saw a large kind of two dome-shaped opacities over on this part of the right maxillary sinus, but that again is completely gone. And I just wish I knew like what therapy was rendered. If it just spontaneous disappeared, which can also happen, that's a great news for the patient. So besides this small localized mucosal thickening along the floor of the sinus, right maxillary sinus is grossly clear. So that's wonderful for the patient, right? So again, here's the right maxillary sinus now, and then the left maxillary sinus, and compare that to a year ago, right maxillary sinus and left maxillary sinus. So that's all I wanted to show you today, because it's not always that I get to see dramatic improvement in the patient's maxillary sinus. Often I don't have a follow-up scan, so so it's not easy to share those. But in this case, we have two scans that are taken about a year apart from each other. And I think this is a great example of what could happen if the patient either received a proper treatment, or in some cases, there could be a spontaneous resolution of sinus lesions as well. Anyway, thank you very much for your attention, and I'll see you in the next video. Take care, everyone.